woman over 40 years old experiencing back pain, it is because of an unstable pelvis. One of the muscles in charge of stabilizing your pelvis is the transversus abdominis, also known as your waist muscle, or in Pilates terms, your corset muscle. It hugs your front tight like a corset, drawing your center in and together, and it even wraps around to the bottom of the back, providing support from the back to the front to keep that pelvis in place. And standing up against a wall can help you to feel it activate. Start by standing in place, just marching those feet out, making sure that you land with those feet hip distance apart and with some space between your feet and the border of the wall. The back of your rib cage up against the wall, keeping some space between your feet and the wall. Place your thumbs on the bottom ribs and splay your fingers open across the rest of the abdomen. Take an inhale into those bottom thumbs and into the rest of the fingers, and feel how expanding through those ribs and through that abdomen presses the back of your ribs a little bit harder against that wall. And then as you exhale, draw your abdomen inwards and draw your ribs towards each other as if you are tightening that corset. Inhale, breathe into those fingers, breathe into the low ribs especially, so finding where those low thumbs are and pressing air into there on an inhale. And then exhale, tightening your center inwards as if you were trying to draw your hands closer together without physically sliding the hands closer together. And inhale, breathe into that. Exhale, contract. If you keep the back of your head and the back of the ribs pressed up against the wall as you do this, then you'll be keeping yourself aligned. So without that activation of the transversus abdominis, without the strength of the transversus abdominis, your pelvis is going to shift, it's going to twist, and it's going to tilt or tuck. It might do all of the above, just kind of depending on how you move and what sort of compensations your body uses to move in the most efficient way. So finding exercises or a workout routine that focuses on strengthening that corset muscle is going to be paramount to relieving any pain associated with that unstable pelvis.